Now, shall we move on to the next session, session 2? And I would like to invite Professor Dr. Mohanan Kundumal, who is the Professor of Radiology, as well as Vice Chancellor of Kerala University of Health Sciences and University of Kerala, and who is also a member of National Medical Commission. Welcome, sir, to chair the session.
Very good morning to all. Pranams to Swamiji, Riyamji. I'm extremely happy and proud to be here. In fact, I always wanted to come to Rajiv Gandhi Center for Biotechnology, but then the call came through Sri M. He said, you come here, so I'm here. That's all. It's just like that. And being the Vice Chancellor of Kerala University of Health Sciences, and we know the importance of yoga because it is the science of Bharat. It was with us for thousands and thousands of years. And at various levels, we realize how good it is, how useful it is. But then today's scientific community, today's world knows evidence-based proof. You need proof, and then only you will believe. In fact, certain things you will believe without proof, but then people insist that you need proof. And therefore, we need to have very good scientific deliberations, scientific investigations. And we had an excellent talk just now only with a lot of evidences. But then we need such more and more evidences. And also, we need good schools or colleges where they train the science of yoga. Unfortunately, no college in Kerala trains yoga. Under Kerala University of Health Sciences, we have medical colleges, Ayurveda colleges, Unani, Siddha, Homeo, everything is there. But there is no institution under the heading yoga. And therefore, I was dreaming that a yoga institute will come in Kerala, most probably in Akkulam, that's what. And if that comes, Kerala University of Health Sciences is very happy and proud to give affiliation and recognition. This is what I want to say. So let us go to the program. The first speaker with us is Dr. Manjunath. He is from IIT Kharagpur, where medicine and technology merges, and he is an eminent physiologist in the B.C. Roy Multi-speciality Medical Research Center. And he is physiology, yoga, and this is the right thing to talk.
Thank you.
Welcome.
Namaskar, good morning, and thank you for the introduction, and thanks everybody for coming. As I have been already introduced yesterday in detail, therefore I don't need any more introduction, I guess. Those who have joined only for today, we can discuss later. Therefore, though I am working in this is the first IIT that's going to start a medical school to bridge the gap between medicine and technology. That is the idea. Therefore, I have been trained in All India Institute of Medical Sciences in New Delhi, and then I have worked in Mayo Clinic. For I thought this is the best opportunity for me to help in establishment of this. And I am also an adjunct professor of integrative medicine, which is a part of integrative physiology in another institution. I have no conflicts of interest to disclose. I'll stick to time, or maybe even before time. There are two things that I would like to disclose right now. One is that there will be a lot of overlap about what I'm going to say and what previous speakers have already discussed. Unfortunately, this has happened because this talk was supposed to be yesterday. That's how the scientific program was initially designed, and for whatever unavoidable reasons, this talk has been pushed to today. Therefore, please bear with me because there is a lot of repetition. And second thing is that the repetition happens because many of the speakers talk beyond their subject domain. I will stick to my subject domain, and therefore there will be some overlap, and therefore you may feel bored. If you feel bored, let me know. Okay, these are the only disclosures I have. Therefore, we have discussed a lot about yoga, what it is and what it is not, since yesterday. And I have yesterday also clearly mentioned or at least try to stress that what we need for any study on yoga is evidence, evidence, and evidence. That's all. Without evidence, we can't really speak much about that. Therefore, I'll stick to the evidence, but I will not actually encroach on other domains because there will be speakers coming up, including cardiology or neurology or psychiatry, and therefore I will not get into those domains. I'll just mention what are the possibilities. So this is one of the best definitions of yoga I have ever heard by Sri Aurobindo. It says that yoga is a methodized effort towards self-perfection. Okay? Therefore, each word has a lot of meaning, which scientifically makes sense to me. Therefore, there is a method. That's exactly what we want. For it is a methodized effort. For what? Perfecting ourselves. In what domains? All domains. Okay? Therefore, yoga has deals with multiple domains, and one statement like this helps us to understand the breadth of yoga and what is its intention. Therefore, we will try to understand based on that. Yesterday itself we had discussed, or I had discussed with you, that there are different types of yoga. It's really confusing if you start reading yoga literature, that you don't even understand what yoga is, and you get actually confused for whether you know yoga or somebody else knows yoga better than you. Because there is Hatha Yoga, which is the most researched, and there are others. Hatha Yoga mainly deals with the yogasanas, and there is Sudarshan Kriya Yoga, where the stress is more on respiratory movements. Therefore, there are some studies that were being done when I was in AIMS. This was also. And then Iyengar Yoga is basically Hatha Yoga. Sahaj Yoga, Vinyasa Yoga, it's a kind of a fluid movement yoga, Vinyasa Yoga. Power Yoga and Hot Yoga, these are basically American versions of yoga, and they have got yoga into a lot of disrepute. And yesterday I had discussed, Hot Yoga is also called as Bikram Yoga. You can search and then you will understand how yoga has been used as a brand, not as a science and art. Therefore, many a times when we see US literature especially, it is looked at as a brand and everything as a monetary value there. That should not be the case for us, especially from India. We need to support it purely on scientific basis rather than on its brand value. Forget about the brand part of that. For I would be mostly restricting myself with Raj Yoga or Patanjali Yoga or Ashtanga Yoga. Therefore, Ashtanga Yoga has 8 components. Therefore, these are Yama, Niyama, Asana, Pranayam, Pratyahar, Dharana, Dhyana, and a state called as Samadhi. For most of us are aware of it. I'll try to look at them scientifically. Yama are basically ethical restraints. No's, don'ts. You should not do this. You should not cause pain to others. Ahimsa, Satya. All these are basically no, don'ts. The Niyamas are rules to be followed. These are personal observances like Shaucha, Santosha, Tapas, Swadhyaya, Ishpranidhana. Therefore, these are 5 components of that. Therefore, basically, these are preparatory codes of conduct. For we need to have certain preparatory codes of conduct as a part of the whole yoga, though we may not be able to follow all of them. Then the next 5, that is asana, which is basically exercises or postures, pranayama, the control of breathing or controlled breath, pratyahara, sensory restraint or withdrawal, dharana, that is concentration, and dhyana, meditation. Therefore, we are aware of these words being used in scientific literature. Now, these are the techniques. Therefore, there is a method involved in this. For these are specialized techniques that we can use to achieve a goal. Therefore, there is preparatory code of conduct followed by techniques. Then you will reach a superconscious or non-dualistic conscious state called as samadhi. For you attain it, it is a state, experiential state, but it is not a technique. Therefore, whatever we discuss about yoga now, we look at mainly the specialized techniques, how these help. So what are the physiological effects of yoga? So when we go back here, you can see that there are 3 major components of the body that are affected. One is yogasanas. Therefore, it affects all the muscles of the body and the joints and maybe the bones. Therefore, yes, these are exercise, purely exercise. For any scientific study on exercise should follow certain guidelines. Then yoga is also having an exercise component. Then pranayama is controlled breathing. Now, when we say controlled breathing, we should not look at pranayama away from asana. For a good yoga teacher, I have been practicing yoga for a long time, but a good yoga teacher will always understand that asanas are always coordinated with pranayama. Therefore, there is a breathing synchrony with the asanas. Therefore, does pranayama start later? No, it starts with asanas. For we should understand that. Many of us don't understand. We think pranayama is separate. Yes, there are different types of pranayamas. That is different. But the pranayama begins with asanas. What about pratyahara, sensory restraint? Is it a separate thing? No. You are asked to concentrate on your asanas. You are asked to concentrate on your breathing even during asanas. What is that? That is sensory withdrawal. Therefore, you are not concentrating on something else. You are concentrating on what you are doing, which means that you are in the present. For some of these things are not stressed when you are taught about yoga, and therefore we think that these are all piecemeal, separate. No, they are not separate. Then dharana, concentrating. Is it a separate thing? No. It is a part of yogasana anyway, because you are supposed to concentrate on the muscle that is being stretched, the joint that is undergoing stress. Therefore, you are actually doing all four when you are doing yogasanas, if you are taught properly. But the problem is that you are not taught properly. Yesterday I discussed, therefore there is no pragmatic information to the patients or the subjects who want to undergo this, and therefore they get confused. Oh, do I do pranayama later? No, it has already started. Do you have to do dhyana and dharana later? No, not necessarily. For that is how we have to integrate, and then our studies will be more meaningful rather than doing them separately and studying them separately. It doesn't really help, because that is not the purpose of yoga. The purpose of yoga is to integrate everything. Yoga means yoking, joining together. Yesterday I discussed already. Okay. With this understanding, I'll try to superficially make you understand what is the evidence available. Therefore, one of the important systems in the body that would be affected would be respiratory system, because there is a breath control with everything. For normally, respiration is kind of the only system in the body which has dual control. You have a voluntary control and you have an involuntary control. You cannot commit suicide by stopping your breath. That is impossible, because the involuntary control will override, and you cannot do anything about that voluntarily. So therefore there are both controls. There is the only system which has both components, and that is why all autonomic functions which are supposed to be not controllable can be controlled through breathing. Okay, that's why cardiovascular system, which is integrated with respiratory system, always it's a cardiorespiratory system, can be controlled through breath. So that is how we need to understand nervous system also, sympathetic, parasympathetic. Previous discussion was going on, and there was kind of, we lose the focus of sympathetic, parasympathetic by looking at only nervous system. No, nervous system is not independent of other systems. So we should not look at only the brain. You should look at the body as a whole. Yoga has everything for the body, not just for the brain. Okay? Therefore, we shouldn't be looking at only area. For as a physiologist, as an integrative physiologist, I try to look at it as a holistic approach. Therefore, naturally, when you control your breath, or can we measure the parameters related with respiratory system, there is a system called, device called as spirometer, which has multiple waves like this, which basically measures how much you breathe in, breathe out, what is your capacity and all, just for your information. So what basically we have seen is that by doing yogasana for a long time, your respiratory rate decreases. Therefore, you control the breath. Rather than 12 breaths per minute normally, in pranayama we teach them to do around 6 breaths a minute. Therefore, each inspiration 5 seconds, expiration 5 seconds. Therefore, 10 seconds each breath, 60 seconds 6. Yeah, that's what happens. That is consciously you do, but it becomes an unconscious thing later on. Therefore, there is a decrease in the respiratory rate. Therefore, the amount of air you take in will also be less. Therefore, if somebody says that by pranayama you actually took in more air, oxygen levels improve and all, you can read that in scientific so-called literature, that it improves oxygenation. No. Oxygenation cannot be improved beyond what we already normally have. It's 100% saturated. Okay. Therefore, that decreases minute ventilation. And what is the benefit? You basically you spend less energy on breathing. Therefore, you might have also seen that whenever you are stressed, what do you breathe? Your breaths are shallow and rapid. No, but when you are relaxed, your breaths are deep and slow. This brings relaxation through breathing, breath control. Therefore, breath control is the most important part of yogasanas. And we have a misnomer. Pranayama means control of breath. No, pran means energy. Ayama means regulation, control. Therefore, basically it controls whatever energy, the reflective of that energy is respiration. Therefore, we can do other parameters using advanced small equipments, and some of those changes that we can see is that the amount of lungs, air that you can hold, which is called as vital capacity, that can be increased. And at the same time, we can also see that there is a change in the breath holding time, the pressures that we can generate in the lungs, and also sensitivity of certain receptors in the body which tell about how much oxygen we have. It's called as chemoreceptor sensitivity. Basically, it senses carbon dioxide also and oxygen. So this is mainly about respiratory system. Therefore, those who are practicing yogasanas for a longer time, they can control their breath much better than rest of us. But the respiratory system is always integrated with cardiovascular system, heart and the blood vessels. Do we have any effect on the cardiovascular system? Yes. There is a decreased heart rate and decreased blood pressure. There is evidence, I will show that. Okay, therefore you can see here that these are 10 different participants who are undergoing yoga treatment. And the darker one is the post-acute effect of yogasanas, and the first graph here for each individual is pre-exercise heart rate. Therefore, some of them decrease their heart rate, some of them increase their heart rate acutely. Therefore, it is not acute that is important. But over a period of 26 weeks, in the next graph, as you can see, whatever be their individual heart rate, as a group, there is a consistent decrease in the heart rate both before and after yogasanas, which means that there is enough evidence to show that you can reduce your heart rate. Similarly, for blood pressure also. Therefore, this is for again each individual. Many of them were in the hypertensive ranges here, and both for systolic blood pressure as well as for diastolic blood pressure. But as we progressed over a period of 26 weeks, as a group, you can see that there is a significant decrease of their systolic blood pressure from here to here, before and after, as well as the diastolic blood pressure. Yes, therefore, there is evidence clearly showing that there is change in the heart rate as well as blood pressure that can be brought about by yogasanas. What else happens? Therefore, there is a change in the vagal activity. Vagus, our previous speaker has already discussed. Therefore, there is a decrease in the heart rate because of increased in the vagal activity. Okay, and there is a change in the heart rate variability. We don't have to worry about that. I mean, this was designed for both kind of audience, including medical audience. There are sensors called as baroreceptors for pressure sensor. Their sensitivity can be restored. It seems that one of the causes for hypertension is resetting of baroreceptors. Therefore, they lose their sensitivity. That's why your baseline blood pressure is higher. If we bring their sensitivity back to normal, the baroreceptors, the blood pressure decreases, and it has been clearly shown that yes, baroreceptor sensitivity can be decreased by yogasanas, certain yogasanas. Therefore, this is a general statement. And there is also a better cardiorespiratory fitness. Therefore, you can do exercise better, and at the same time, you recover better. And that's exactly what is important for athletes. Not only that I do a bout of exercise now, but how fast I can recover so that I can do the next bout of exercise. That is also been shown by certain tests called as Harvard step tests and other things, which we can do in the laboratory. Yes, their heart rate recovery is much better, which means that they are able to sustain the exercise stress better. The third important system that is affected is musculoskeletal system. It's shown that the muscle tone decreases and the spasm in the muscles decreases. Now, one of the important psychological things that we have seen is that if you tense your muscles artificially, you get stressed. For whenever there is a stress, your muscles are tensed. But if you relax your muscles voluntarily, you feel relaxed. And there is a link between the muscles and the brain and your psychological status. Therefore, voluntarily you start relaxing your muscles and you start feeling better. How is that? Because there are certain connections between the muscles and the brain. Therefore, muscles are also important. Therefore, if you decrease the muscle tone and their spasm, you start feeling better. At the same time, it can increase the strength of certain groups of muscles, and it can improve the range of movements, balance and flexibility. This is exactly what is most important for elderly people. And the previous speaker was speaking about how yoga is beneficial for elderly people. Yes, there is a lot of evidence about how yoga being very, very helpful, especially in elderly who have the major problem of musculoskeletal instability. For muscles are not strong, the joints are weak, and at the same time they don't have balance. And all these things are improved in an integrated way by yogasanas, and there is enough and good quality evidence. Therefore, that is something. For here you can see I'm just projecting one. Therefore, after 8 weeks of yogasanas, there is a consistent change or improvement in the range of movements. ROM stands for range of movements, and flexion and extension movements significantly improving. And also there is increase in the strength of upper extremity, lower extremity, and at the same time they can walk better and they can do tests better. So all these things have been clearly shown to improve, especially in the elderly, but it affects younger people also. But younger people, we already have enough of strength and movement. That's not a major issue for the younger people. Now, what about the other effects? For general and metabolic effects, it has been shown that yoga can be helpful in reducing weight, but much more so in preventing weight gain. Therefore, it doesn't really reduce that much weight, but it prevents you from gaining weight. Therefore, people who follow yoga are less obese and they have better lifestyle, as you can see from this data. Therefore, yoga practitioners are less smokers, more of them are vegetarians, the dark one, and very few of them are actually obese. This is data that is available from the US. Therefore, yes, those who are practicing yoga, they have a better lifestyle. Whether that better lifestyle is beneficial, we don't know, but yes, as long as it benefits the body, that's good for us. It doesn't have to be any one part. They have a better lipid profile in the blood, and they have better antioxidant defense. There are a couple of enzymes called as glutathione peroxidase and superoxide dismutase. Some of them have a better value, which prevents you from oxidative stress. What about the nervous system? This will come in the next one. Therefore, I will just briefly go through, because there are talks on nervous system. There is a decreased sympathetic and better parasympathetic activity. There is an alpha rhythm in EEG, better alpha rhythm, which indicates relaxed state of mind. And there is more coherence between the cerebral hemispheres. Most of us do not know that there are two cerebral hemispheres. They work independently actually, and that is bad for us. If you start integrating right and left is supposed to be more logical and mathematical, right is supposed to be more intuitive and creative, and that is true. Clearly, there are tests which we can test independently of these two brains in physiology. We do that. For coherence is better if you do this yogasanas, and it has been clearly shown. And there are better cognitive performances, both verbal and spatial skills. There is better pain tolerance, decreased fatigue, better sleep, and at the same time, as previous speakers had already indicated, there are better brain volumes, and at the same time, more gray area or gray matter in the brain. And there are certain growth factors called as brain-derived growth factors that are released in the brain and rest of the body, and they are all supposed to be beneficial, and it decreases the anxiety levels and stress levels, and there is a sense of well-being, increased sense of well-being. The other important system is endocrine system, that also briefly touched upon by speakers, that there is decrease in the glucocorticoid levels, which are basically stress hormones. Therefore, less of them, better for us. But there is a better response of glucocorticoids to any acute stress, which means that you are better equipped to face the challenges. There is better melatonin level. People talk a lot about melatonin, which is basically a hormone of pineal gland, and there are a lot of myths about melatonin. Therefore, don't believe all those myths about pineal gland and melatonin. Though melatonin is useful, there is a decrease in the blood glucose levels, better insulin response, and less of thyroid hormones, which basically decrease the metabolic rate. And there are evidences which show that there is change in the gene expression. Yesterday, Dr. Srinivas also already discussed about this. Therefore, what are the health benefits possible? There are multiple diseases that have been shown to be benefited by yoga, but I don't want to go into the details because these will be discussed by the respective speakers. There are certain mechanisms that could be responsible. One is that there is an improvement in the insulin sensitivity, or there is a better risk profile, change of neuroendocrine mechanisms, modulation of cytokines, or even at the cellular, subcellular level, there could be changes. Those who are interested, please go through this one, and this is a very good book. I recommend all of you, please go through this book. This is one good book written by William Broad, which discusses everything about the risks as well as the benefits of yoga. Thank you. I think I have stuck to my time.
Thank you, Dr. Manjunath. Excellent talk.
Thank you.
Giving a lot of clarity. Do we have questions now, or at the end of? At the end of the session, we will have questions. So ready with your questions. Next speaker is Dr. Rajesh B Iyer. He is a consultant neurologist and epileptologist. He is from Purna Neuro Super Speciality Clinic, Bangalore, Manipal Hospital, and is an honorary consultant, Multiple Sclerosis Society of India. Dr. Rajesh, please.
Thank you, sir. Namaskar, Guruji. Respected chairpersons and dear friends, let me thank the organizers for having me here for this talk. So my focus will be on yoga and neurology. You heard a lot in the last couple of sessions about how yoga works, but let me tell you that there's a lot of literature about how yoga works in various kinds of physiological as well as pathological states. Now, when I was a student, when we said that you should practice yoga to our patients, we used to be looked at quite skeptically, saying that, this is humbug, or it's not something which is evidence-based. So when we look at medicine, it has to be evidence-based. And if you look at the publications which have come in the field of yoga, the last couple of decades has seen tremendous number of publications, and from good centers, including NIMHANS, and these publications validate the benefit of yoga. So how have these studies been done? So either they have looked into the case versus control. They looked at yoga practitioners. They looked at their brain volume and brain functions and compared it with controls. Or they have, and there could still be a bias in this. So they have matched these patients or these subjects with controls who could do similar physical activity. We know that physical activity does influence the brain functions. So they have compared and accounted for the physiological effects of physical activity, and then they have found various data. And primarily what these findings are is that there is an increase in brain volume. Now, most of us, as we age, our brain starts shrinking, and roughly after 50 years of age, the brain shrinks at about 0.4% per year. Now, what have these studies shown is that the brain volume can increase with regular practice of yoga, and all attributes, what Dr. Manjunath was saying, it's not just exercises, it's the Ashtanga yoga which makes the difference. It's also found that through functional MRI techniques, so functional MRI, the routine MRI just looks at the structure, whereas functional MRI can tell us how the brain is connected, what functions are in different parts of the brain. So, and there are tractographic techniques also which will tell us how the tracts are, how the networking happens inside the brain. So these studies have shown that there is increased functional connectivity as well. So yoga practitioners had greater cortical thickness. In the brain, there is the outer layer of cortex and the white matter inside. Cortex is the one which is rich of neurons, the cell bodies, and the axons which come down from there are the white matter. They are just the transmitting structures. So what is important is the gray matter. So these studies have shown that in yoga practitioners, the cortical thickness was much better. There was greater gray matter density. And when compared to the non-practitioners, this was quite significant. And there was a positive relation between the years of yoga. You say that I did yoga for a month, nothing happened. It's not like that. There's a positive correlation between the number of years of yoga and the intensity and the duration of yoga practice. And in functional MRI studies, it has also been found that the left prefrontal cortex, different parts of the brain has different functions. The frontal lobes have primary functions in various kinds of regulatory activities, judgment, insight, impulsivity, all those things. And the temporal lobes are primarily with memory. There are different aspects of memory, at least some aspects of memory on the temporal lobe, and the emotions in the inner part of temporal lobe. So it has been found that the prefrontal lobe activity is influenced by yoga practice. So practitioners who do yoga regularly have a better control over their emotions, and they don't react to circumstances, maybe they respond to circumstances. And they're able to disengage from various types of negative influences. If you look at the newspaper today or hear news, it's all negative news everywhere. Serious yoga practitioners can stay aloof from all those kind of things. This diagram was put up by Dr. Shivashankar. As I said, brain shrinks with age. And physical activity and mindfulness have protective effects on this. Yoga is holistic. It combines both physical activity in the form of yogasanas, mental activity, yama niyama, pratyahara, then everything is all put together. So when I got initiated into meditation, my Guruji said, you don't worry about all those things, you start from the top of the pyramid, that is, you start from meditation, other things will fall in place in due course of time. And that's true. So yoga is not just asanas, it includes all the other steps in the Ashtanga yoga. And we know that yoga also enhances neuroplasticity. Now let us look at some of the evidences that we have in various kind of neurological disorders. So there's a lot of articles in this regard, and this is one good, if anyone wants to read about this, it's good. It has come from S. Vyasa, Bangalore. It has covered various diseases. I'm not going into the details, but let me put up few case examples here which can highlight the role of yoga in various dimensions of disease and health. All of you would have seen Parkinson's disease. It's characterized by tremors, resting tremors, stooping forwards, slowness, imbalance, falls. As disease progresses, cognitive decline, and generally patients become bedbound in a matter of 1 or 2 decades. Now, there are studies which say that yoga plays a major role in slowing down the disease process as well as improving their quality of life. Let us look at the motor symptoms. One of the problems with Parkinson's is stooping forwards. So when patients are asked to do spinal extension postures or exercises like Bhujangasana or the Setu Bandhasana, they have a tendency to maintain their posture in a better way. So posture and balance, patients tend to walk with short steps. You teach them to walk properly. So probably you need to have a blend of yoga as well as physiotherapy exercises here. Constipation is one of the major problems with Parkinson's patients. You ask any of them, all of them will have this, and often it predates the appearance of motor symptoms. And simple techniques like a yogic diet as well as simple asanas like Pawan Muktasana has made a big difference in many of these patients, and often these patients are refractory to the routine laxatives. Anxiety is one of the most important elements. We saw in the last slide what happens last lecture that the psychiatric aspects of various chemicals in the brain, increase in dopamine is beneficial, increase in serotonin is beneficial. So anxiety is one of the most important aspects in Parkinson's because of decrease in dopamine transmission. And when there is anxiety, all the symptoms of Parkinson's get worse, mainly the tremor, slowness, and other aspects of Parkinson's. Yoga definitely brings in a state of calmness and reduces the level of anxiety. And most patients with Parkinson's can do better, can perform better once they inculcate yoga in their routine life. Similarly, cognition also can improve. Neurodegeneration, as I said, Parkinson's is a neurodegenerative condition. And if anything can slow down neurodegeneration, it's probably that the way we think, the way we eat, and the way we work. So a yogic diet with yogic practice can definitely help to improve the overall degenerative process. And we have evidence that the brain volume increases, so probably that should help to restore the brain functions. Now, dementia is one of the major issues that we face day in and day out. Unlike Western world, we are seeing dementia in younger patients. Even in their early 60s, we are seeing dementia. And it begins with mild cognitive impairment. So that's the right time to interfere. And we still don't know what triggers the process of dementia. Various kinds of genetic tests have not yielded anything concrete. But we know that the deposition of amyloid as well as various kinds of proteins like tau proteins in the neurons, leading to destruction of these neurons. And the disease begins with mild cognitive impairment, and as time evolves, various cognitive faculties are lost, and ultimately, the burden is more on the caregivers than on the patient, and it leads to poor quality of life for both patients and the family. And if we pick up mild cognitive impairment early and initiate processes to slow it down or to improve, that can make a huge difference in the life of patients and their relatives. So there's enough evidence for this. As I said, brain volume increases with yoga, and that's something which we need to capitalize upon in patients with mild cognitive impairment. So does everyone who has memory impairment get into Alzheimer's? No. So as we age, some amount of lapse of memory, just like finding names or recognition of common things, becomes difficult. Not that it is a pathology, it's just part of a normal aging process. When it goes more than what is expected for that age, then probably we need to seriously look at dementia. But even in such instances where you have problems with age-related cognitive dysfunction, things can get better by a proper yogic lifestyle. And it's also been found that the food that we eat can have an influence. So there's one study which has shown that primarily a plant-based diet can make a big difference in such instances. So, interventions, meditation intervention. So we say that yoga is difficult for people who are aging, but that's not so. We have seen people start yoga practice even after 80 years of age, and meditation can be done at any age. So this data suggests that it can make a big difference in people who normally age. Now, this was touched upon by the previous speakers, and I'm sure most of you would have had a family member who has had a fall and a fracture. Very often, fracture in elderly might indicate a more serious nature of the disease and probably lesser lifespan. So simple techniques right from the middle age, simple asanas to maintain balance can be of immense help in preventing falls and imbalance. Now, migraine is a very common problem. I'm sure many of you here would have had migraine headaches. It affects about 15% of the population. And the basic mechanism that's involved here is inflammation in the blood vessels leading to vasospasm. So migraine happens because of a genetic factor, but a lot of trigger factors are there. Simple things like going out in the sunlight, not having food on time, certain triggers like perfumes, not sleeping well. So there are many lifestyle factors which influence migraine. Now, roughly about 20 to 30% of patients have refractory migraine. Unfortunately, the medicines that we have don't cure migraine. They just help prevent the headaches or make life slightly better. So when we approach migraine with a holistic attitude, so when we introduce all the lifestyle measures, when we ask them to do regular yoga, pranayama, drink plenty of fluids, avoid triggers, that makes a huge difference. And what does yoga do? You know, when you do breathing, various types of pranayamas, it has an influence on the autonomic nervous system, which was just touched upon the last talk, and it changes the blood gases. So once the blood gases change, there is cerebral either vasodilatation with carbon dioxide or vasoconstriction with oxygen, and that can have a strong influence on headaches. In fact, for one type of headache called cluster headache, which is quite intense and persists for days to weeks, the treatment is oxygen. So if somebody is able to do regular pranayam, a cluster headache incidence can certainly be brought down. And as I said, yogic lifestyle is definitely important in patients with migraine. And mind you, patients with migraine really have to take a break from their work. It leads to a lot of absenteeism in their work. So simple techniques of yoga can make a big difference in their lives and productivity. Now coming to yoga and epilepsy. Epilepsy is a common disorder. I'm sure most of you would have seen seizures. It affects about 0.5% of the general population. And a recent Cochrane review has shown that it has had immense effect in patients with epilepsy. This was one study which I did as a student with my professor, Dr. Radhakrishnan sir. Here we looked at the effect of a yoga meditation protocol in patients with drug-resistant epilepsies. So every person with drug-resistant epilepsy cannot be operated. We do operate if there is a clear-cut evidence of a focal epilepsy, but not all of them. So this was a study which was meant for patients whom we could not operate. And what we found that if patients practice yoga regularly, we had a yoga teacher who used to train these people, and if they practice it regularly for at least 6 months, the effect was quite immense. And at least 6 out of these 20 patients with drug-resistant epilepsy became seizure-free, and which I feel that is a very, very commendable achievement which no drug could achieve. So how does yoga help in epilepsy? We just heard about sympathetic and parasympathetic activity. So there is a nerve called the vagal nerve, which is primarily parasympathetic. So there are devices called vagal nerve stimulators. We put it in the neck, and that increases the vagal tone. And the nerve goes up and down. It comes from the brain and goes to the heart, but impulses travel both way in the nervous system. So when you stimulate the vagal nerve, the parasympathetic sympathetic tone increases, and that causes a kind of calmness in the brain that produces something called a refractoriness in the nervous system, and that leads to control of seizures. Similarly, when you practice yoga and increase your parasympathetic tone, that is likely to benefit in the same way, and that is reflected in this study. Multiple sclerosis is another important disease. Though rare, it is quite devastating, typically affects young productive people, and untreated it leads to a lot of disabilities, and roughly half the patients will be wheelchair bound if not properly treated. So there are various studies which have shown that multiple sclerosis can improve with yoga and meditation, and primarily the disease is of the immune system. Your immune system produces certain reactions, the lymphocytes become autoreactive, they get into the nervous system and cause havoc there. So if you can influence the immune system to become less active, less responsive, then probably your MS can get much better. In fact, there are various kinds of diets for multiple sclerosis, and what is evident is that people who consume more milk, more dairy, their MS also tends to flare up more. MS can affect almost the entire body. Although it's a disease of nervous system, we know that nervous system controls the entire body. So common symptoms would be fatigue, spasticity, there's stiffness, balance issues, cognition, behavior, bladder issues, and then depression. And the yoga meditation practice can work as a disease modifying agent also, along with the mainstay therapies. But unfortunately, what has happened is many people, they leave the mainstay therapies and get on to only yoga or Ayurvedic based treatments. And I've seen many people get onto the wheelchairs because of this. So yoga should be used as an adjuvant in such kind of diseases and not as a mainstay therapy. So if people understand this, then you can really make a big difference in people suffering from these kind of disorders. Dr. Vinitha touched upon back pain in children. So this is a very common problem, mostly posture related or work related. And simple techniques to strengthen your back muscles, maintain posture, would be sufficient to prevent many people from getting into the surgical theatres. So the commonest thing is a lumbar disc bulge. Very common, you accidentally lift a weight or you bend down in any awkward posture that is sufficient to trigger a disc herniation. So if properly practiced, various types of exercises can not only prevent back pain and disc related problems, it can also improve. Now, many people believe that once a disc herniates, it doesn't go back. But I have a lot of instances where people who have been practicing both physiotherapy as well as yoga combined have a regression of the disc bulge to a great extent, and they are almost asymptomatic. So these are patients who were otherwise offered surgery by the spine surgeons. So keep in mind, this is something very simple. Most of us suffer back pain and can be prevented by regular exercises. Now, what are the other effects of yoga? Most important thing is the quality of life. After doing all these things, what are we going to achieve? So the quality of life is in the mind and not in the body. When we sleep off, you are totally cut off from everything. When you wake up with all the problems or all the goodness, whatever is more. So here comes the question of why somebody should suffer a particular disease. Many things we can't explain. For example, a child has a tumor or somebody loses a limb in an accident. So what makes this happen? Similarly, we have seen many instances where somebody has, say, a stroke and weakness on one side. The same side gets affected repeatedly. Even if the patient improves, you get fractures or other complications happening on the same side. So the only way to explain these kind of unexplainable circumstances is the karmic concept. And I'm sure yoga, the yogic philosophy, helps to overcome these kind of karmic problems. The greatest counselor that we have had is Lord Krishna. So when Arjuna wanted to run away from the battle, it was the counseling through Bhagavad Gita which brought him back to the battle and established Dharma. So, but this is not just a story or a philosophical text. There's a Krishna and Arjuna in each one of us and in each one of the patients that we see. So if you are able to stimulate that and make them realize that, okay, this is what is happening in your mind, you need to counsel yourself, get out of it, probably that can make a big difference in their quality of life. And also it will help people to endure certain disease as well as death. So when the question comes of why me, the only way to explain that and endure that is to understand the karmic concepts. So how is yoga different from exercises? This was brought out in the last talk. Physical exercises are also, there are various postures and activity in the muscle. But yoga is a little bit more than that. It's combination of isotonic and isometric. Dr. Manjunath can explain more about this. But it involves focus of the mind on the body. So it's a mind-body medicine which adds to more dimensions, and it doesn't allow your sympathetic overactivity or burning of various chemicals in the body, unlike aerobic exercises. So that's an important aspect of how yoga is different from the routine physical exercises. Now, what are the problems that we face with various types of yoga-based interventions and the data we have, and what are the solutions for this? Now, as Dr. Manjunath was mentioning, there are various names and techniques. There's Sahaja Yoga, Ashtanga Yoga, Kundalini Yoga, hot, cold, whatever. So there is no standardization. And for a Westerner, it is easily confusing. Not only for a Westerner, even for us, when you start reading about yogic literature, say we did Sahaja Yoga for 20 patients and we found this. So you have to find out what is Sahaja Yoga. So there has to be a uniformity among all the studies that we have. Maybe if we can come up with a brochure saying that, okay, these are the yogic practices. Don't give it a specific name, but probably give it a protocol, what you're going to do. That makes it more meaningful. Another thing is, it's difficult to measure the depth and intensity. Somebody says that, okay, I sat in meditation for half an hour or 1 hour, but we know that that meditation would have been for hardly 1 minute or 2 minutes. So there are no methods to measure how much intense yoga has been or how much effective somebody's techniques have been. So the standardization again becomes difficult, but if it is done over a span of maybe a few months and then you have got a larger volume, probably that can offshoot these biases. And then we have various issues with reluctance of acceptance due to various political, religious reasons, then laziness among practitioners, and then of course lack of belief. So standardization of interventions is needed to ensure reproducibility of the studies and validation of the results. And we need to have awareness programs, particularly in schools and colleges, have yoga as a part of their curriculum. Probably this will make a big difference in our country in the long run. So this is the take-home message I have. There is definitely a growing scientific evidence about the benefits of yoga, especially in neurological disorders. And as I said, yoga causes increase in gray matter volume, which is very good to know, improves functional networks and better reactions to emotions. Very often we are impulsive and react to emotions, shout, do what things, even murders, so that can change. And it's very effective as an adjuvant therapy and not as a mainstay therapy. Can help prevent age-related problems, probably it has an anti-aging effect. Of course, as I said, researchers need to standardize the protocols, and general population and particularly medical professionals need to be more aware about the benefits of yoga and use it as a tool in their daily life. With this, I conclude my talk. Thanks for listening. This is my team. We have a holistic center where we have specialists from various walks of life who try to make life better for patients. Thank you once again.
Thank you, Dr. Rajesh B Iyer, with an excellent talk with a lot of examples and the ideas how we should move forward. Like we should have the curriculum, a SOP, how we should do. Again, that has to be discussed in detail. Now we are going to the next speaker. Next speaker is Dr. Easwar H. He is the professor of neurosurgery. He is a surgeon. He's come from Sri Chitra Institute of Medical Sciences, and happy to say that he is my junior in the Trivandrum Medical College, so that makes me happy. Dr. Easwar, please.
Thank you very much, sir. Revered Sri M, respected chairperson and my senior at the Government Medical College at Trivandrum, Sri Mohan Kundumel, all the eminent members of this audience. How do I? Not there on the screen. It's not on the screen. Fine. All right. It's fashionable nowadays to begin with disclaimers. Everything starts, no animals were hurt in the making of this presentation. Well, I say that this presentation is not about science or scholarship, but this is about my experiences as a neurosurgeon for the last 23 years at the Sri Chitra Tirunal Institute for Medical Science and Technology. Also, this is not about yoga, but this is all about what makes yoga a very relevant form of what you call practice, which makes life better. There are several things in your life which cannot be changed by anything. But then there are several things in life which can be attenuated by our practices in everyday life. So this talk is about what makes yoga relevant to us. So this is about neurological phenomena and well-being. Now, before I start, as I said, this is not about science or scholarship. This is Dr. Vilayanur Ramachandran. He was trained in the Stanley Medical College. He was a cognitive neurologist. He wrote an interesting book called Phantoms in the Brain. This is about phantom pain when a person perceives that he has a limb when the limb is not there. Now, his style of writing is not about statistics and evidence. He writes in a kind of way in the 17th century science literature was done. It's about kind of storytelling, anecdotal, and therefore bringing it more closer to an audience which does not have, people with scientific traits, common man. So that's what I am trying to do. Now let's look at some of the chemical messengers in our brain which influence us. I'm sure all of you must have heard of adrenaline. Well, let's look at it. It's called as a flight or fight response hormone. It's something which gives us the strength to fight or flee from a site of danger. Now, this hormone was there for the caveman. As you know, the caveman fought the elements of nature so that he could survive. So, here a man sees a lion. How does he respond to it? he runs as fast as possible away from the lion or gets a weapon to fight it down. Now, when this leads to a trigger of adrenaline release, and what does it do? Your blood pressure rises because you need more blood to fight. Your muscles need more blood. Your eyes dilate so that you can see better. Your muscles become taut so that it's ready to do the muscular activity that is required. Fat gets mobilized for energy needs. Digestive juices, including hydrochloric acid, gets secreted so that energy needs are met with for this action that's going to follow. Now, adrenaline and the modern man. See, the caveman had all these things. Now, let's flip to modern day, an office or a family or a school or anything like that. Adrenaline cannot wreak havoc on us because the man has a frontal lobe. Now, what does the frontal lobe do to us? Imagine you're a child, less than 2 years of age. Whenever your bladder is full, you pass urine wherever you are. When you get Alzheimer's disease, your frontal lobe atrophy, and then also you pass urine wherever you want. You are on a diaper most of the time. Now, the frontal lobe, when the bladder gets filled, about 100 ml, you get that urge to pass urine. But then we are all evolved human beings. We don't pass urine wherever we want to. We wait for an appropriate moment with privacy so that we can relieve ourselves. Now, by the time 200 ml to 300 ml comes, we are uncomfortable. By the time 400 ml it becomes, you're in dire straits. Now, the man's frontal lobe, as he evolves from a child to an adult, conditions him. It helps him to suppress certain kind of primitive urges like passing urine, like having sex with anybody you like interpersonal relationships. All these things are kind of conditioned by the frontal lobe. Now, adrenaline and the modern man again. A situation in your office. You have been wronged. Your promotion has been held back. Your rival in your office is given a promotion. Every time you see him, adrenaline is released in our brains. Now, unlike a caveman who runs away from a lion, we cannot run away. The other intense emotion that we get is to hit him or her. We want to hit him or her and get it over with it. Now, we can't do that because the frontal lobe says, if you hit this man, he's likely to be hurt. You are likely to be arrested and spend a lot of time in a prison or face the legal consequences of it. This is how frontal lobe tempers your activity of everyday life. But then when we see that adrenaline is released, blood pressure increases, fat gets mobilized for our energy needs. Now, what happens after this? Your hydrochloric acid is there. It's not used for anything else. It burns the lining of your stomach and you get ulcers. Fat gets mobilized for your energy needs. And where does the fat go? The fat just circulates, fatty acids circulate inside the blood vessels and gets deposited inside your arteries. So your arteries become narrower and narrower. So you get coronary artery disease because your arteries are smaller and smaller. Dr. Jayakumar will be very happy to have people getting angry because he can do more bypasses. And my colleague from Sri Chitra, Dr. Rajesh B Iyer, would be happy because there will be more patients with narrowed arteries to the brain, which means that there are more strokes. Nephrologist would be happy because the vessels to the kidney gets narrowed and patient ends up with renal failure and dialysis. Well, this is a win-win situation. Adrenaline is good for the doctors, not for the normal. Now, let's put at modern day situations that we often encounter in our lives. Road rage. Well, I am going for work. When from my Pujapara home to Jagadi, a scooterist kind of barges in from the left side, hits my car. I have an important surgery to perform on that day. Well, what should I do? Should I get out and fight, use and release all the adrenaline that I have? Dumping garbage. This was one situation which I encountered in my practice in my emergency room. A gentleman was brought in because he had a stroke, because he picked up a quarrel with his neighbor who dumped garbage in front of his house. Something as simple as a garbage can incite a stroke in your body. A promotion denied. This led to a person becoming, had to be sent on leave in my department because he developed a peptic ulcer disease, acid peptic disease, sibling rivalry. This was a very interesting incident when I was in my final year of my MCH. There were 3 siblings, 2 sisters and a brother. The father gave a property divided between the 3 of them. The sisters got the coveted parts, whereas the brother got the bad part. Now, every time the brother sees the sisters, he flies into a rage. And one day, he saw them in front of the property that, the land that he was denied. His blood pressure shot up, the blood vessel ruptured, and the patient came there with one-sided weakness and loss of speech. Failing in an exam. We always believe that exams are, in many middle-class homes, exams are sacred. If you fail in an exam, that's the end of the road. That's how we see it. I have seen, even now, about a week ago, a boy had done very badly in an exam. Apprehending trouble in his board exams, he attempted to commit suicide. He ended up not killing himself, but ended up being quadriplegic. This was the tragedy. He's neither alive, he's alive but not well. He's bedbound. What a punishment. Now, all these are triggers of adrenaline. Now, let me go to another story. I like storytelling, and I'm sure, I hope the audience will forgive me for turning this scientific meeting into a storytelling session. A neighborhood lady went to a hotel. This happens to be my relative also. She orders a meal, a hearty meal at around 1 p.m. in the afternoon. As she eats, she's chewing something. She gets some sort of unpleasant sensation and finds a stump of a beedi, Indian cigarette in it. And she promptly vomits. Now, she picks up a quarrel with the husband, and the wife pick up a quarrel with the people who are serving the meal, and they apologize. But then the lady vomits at the end of it and then walks out. Now, what happens? So there was a trigger, the specific trigger, which was followed by a response by the lady. Now, next time, she was going near the hotel in a car. As soon as she reached the hotel, she vomited inside the car. You can see how memory plays a role in the way you behave. Memory leads to a trigger in the limbic system, which is actually concerned with emotions and other things. And this triggers your muscles in the stomach to kind of go into a contraction, which leads to vomiting. Now, there is no BD now. There is no trigger. Now, pain and unpleasant, pain has a role. Memory has a role in our everyday life. But then memory should not be allowed to control you in so much in a negative sense. Let's say, for example, you're a child and you go and touch a flaming candle. You hurt yourself. It leaves a pain in this. But then the child will never do that again because it hurts. So pain, in a way, helps is as a tool to survive, to ensure that we don't end up endangering ourselves in our everyday life. But then, unfortunately, for some, they don't know how to control the pain. Now let's look at how we can turn our systems to our advantage. You must have heard of opium. There was a big war in the 17th century, 18th century in China because of opium. The English fought with a lot of people, made Chinese opium addicts, and took a lot of things out from them. Now, opium is definitely a sought after chemical. But then, body also produces opium in our brain. They're called as endorphins and enkephalins, or endogenous morphine-like substance. Now, what does opium, endogenous morphines, endorphin and enkephalin do to you? It confers a protection against depression, confers a good mood and optimism. So if you are a person who has a daily secretion of endorphin and enkephalin, you're less likely to be a victim of depression and other negative problems which alert our society. A country like ours, a state like Kerala, has conquered most of the communicable diseases. Like, we don't have cholera kind of killing lots of people. We don't have smallpox, which wipes out villages. Even tuberculosis and leprosy and other things have come down significantly because of our socioeconomic improvement as well as because human, the science has progressed. But then the greatest, problem that our society faces now is diseases of the mind. Well, if we can prevent the evolution of the diseases of the mind, we'll definitely will be more healthier and happier in our everyday existence. Now, how do we get our endogenous LPM? Regular physical exercise, meditation, and apart from exercise, apart from the release of endorphins and enkephalins, exercise improves muscle strength, suppleness, and stamina. Blood pressure drops because your blood vessels relax. Constipation definitely is reduced. Menstrual cramps comes down. All these have scientific evidence. Now, so that's where everyday exercise is very, very important. Whether you do it as a regular physical exercise or your what you call stretching exercise in the form of yoga, all these things confers a significant health advantage to our everyday existence. The most important thing is, if you see, the most sought after subject when I was passing through following my MBBS in the US was psychiatry. Again, the time is not far away when in India too, psychiatry would be the most sought after subject for all the people who want to be doctors. And the reason is simple. We don't get our endorphins and enkephalins. Nucleus accumbens. This is another part of the brain, It's very difficult to find where it is. It is located deep in the brain. Having operated for the last 20 years, I have not been able to locate it. But then there are certain functional MRI sequences which finds out the oxygen levels there, what is called as the brain oxygen level dependent sequences, which helps to locate which part of the brain subserves certain specific functions. This audience can relax. We have not yet found an MRI sequence which detects lying in our everyday life. So, nucleus accumbens has been discovered as a part of the brain which is the feel-good center of the brain. Okay, it secretes dopamine. It's also called as the reward center of the brain. So, what are the stimulants of nucleus accumbens? So, if you trigger your nucleus accumbens, you get a sense of happiness because you have achieved something. You have a dopamine secreted there. So, what are the triggers of nucleus accumbens? You start with the list with the negative field elements, cocaine and cannabinoids. They are a huge trigger to the nucleus accumbens. So, because of the drive by the nucleus accumbens, the happiness that nucleus accumbens confers on you, the nucleus accumbens drives you to take more and more cocaine. You take cocaine, you get a high, and this high leads you to avoid the negative effects of not having cocaine. So, you seek more cocaine. This is a self-destructive spiral that many people indulge in. Money, definitely, money is not bad. Nobody knows how much money is enough money. If we know that, I'm sure we would not be toiling like this. But then money also triggers the nucleus accumbens. So more money, there are some people who are kind of addicted to it. Because money gives them a sense of satisfaction which makes them go after more money. And after these two negative factors, I don't want to include money as negative money. Only if you don't have money, definitely you are in trouble. So money is required, but then in moderation. Exercise is the biggest trigger for the nucleus accumbens to release the whatever compounds that are required to confer happiness on you. If you look at a marathon runner, once he reaches the 43 kilometer limit, he is able to run for another 200 to 300 meters, the victory lap, so you call it. What drives him in spite of all, or her, in spite of all the fatigue to do that? It is actually the nucleus accumbens which shuts down all the fatigue, confers a certain sense of achievement, accomplishment, which makes him go further. So exercise is one. Philanthropy, when you do something good, your nucleus accumbens is triggered, which means that you want to do more. Now, when you do in philanthropy, you assume that you're trying to help someone. But the truth is, you have a selfish motive there. You're actually helping yourself by helping somebody to trigger the nucleus accumbens. Last but not the least, there are so many things in the list which I won't be able to cover in this short session. Music also triggers dopamine. Okay, now this is another story. I spoke about the neurological phenomena. Now I come to another story. When I was a young boy, I used to live in the suburbs of Trivandrum called as Karamana. In Karamana, there was a beggar called Chuppayan. His name was Subbayan, but it was kind of corrupted to Chuppayan, who he used to roam around. He was not a classic beggar in the sense. Whenever he's hungry, he will ask for food. The story about Chuppayan was that he had epilepsy in his childhood. And his parents left him on the banks of the Karamana river on a rock and deserted, because they could not have this child with illness. They had other children too. One day, Chuppayan was walking through the dike, which is situated on the banks of the Karamana river. It was around 6 p.m. in the evening. It was already darkness setting in. Chuppayan, unlike a conventional beggar, he was a corpulent man. He was a big man. He had a boyish face and a boyish way of speaking. He was never an adult for us because he always used to hang around laughing, smiling, etc. So when he was walking through this dike in the evening, I was just behind him. I had just finished my MBBS and I was trying to find out what was good for my life, practice or go for more education. Chuppayan was walking in front of me. I had another friend of mine who was a extremely emotional character who used to get angry at everything. There were a few people who were consuming liquor and playing cards. As soon as Chuppayan neared them, I was about 20 meters behind him with my friend. So some of them, at least a couple of them, got up and started taunting him. They made some references about his parents and all. And one of them came close to him. Chuppayan kept his head down and walked across. And he passed. My friend started walking a little faster and reached Chuppayan and said, "Why didn't you respond to him?" Chuppayan had Tamil roots, so he said, "Avangalukku puriyadu. They don't understand what they are doing." Now, this was for me. Can I take a minute or more? This was for me a great experience. Many a times we end up picking up things which you don't need to respond to. This is what I call as perception engineering. You have to engineer your perceptions in such a way that you don't harm yourself. You don't harm yourself. So on that day, when my car got banked by a scooterist, the two things I could have done. I could have gone out and shouted at him, screamed at him, raising my adrenaline levels, raising my all those blood pressure and acidity and all that, forgetting that I have a patient waiting there in my hospital, waiting for my surgery. So you engineer your perception in such a way that you don't hurt yourself. Forget, forgive, and get on with life. So on that day, Chuppayan taught me how to engineer your perception in such a way that you don't harm yourself. I haven't finished yet. A couple of slides more. Mohan Kundumal sir will definitely forgive me for my intransigence. This is again something relevant to you. I think I shared it with Mr. Jayakumar when he came to meet me in my hospital. This is a wonderful book called Wisdom of the Psychopaths. This is by a psychologist from UK. Okay, there was an experiment done in Cambridge where people from all walks of life were brought in and a gun goes off without them knowing in the back of their thing. Their EEG, ECG, blood pressure, all these things are connected. Now what happens is, if I sit there, I get startled and I get my adrenaline secreted. So they brought in teachers, doctors, bus drivers, truck drivers, even some of the psychopaths that they knew, they brought in. They brought in commandos, army people, etc., bankers, etc. All of them were startled and they had a rise in their blood pressure, heart rate, etc. There was only one person who passed this test, and this was a Buddhist monk who had trained himself for several years to kind of shut off all the negative things around him and focus on certain important things in life. This is what yoga would help you to attain. I'm not going into the last slide. It will go on for another 5 minutes, and Kundumal sir would not be very forgiving after that. Well, to conclude, neurotransmitters in the brain are secreted to specific stimuli, and they influence human behavior and health of individuals. Control of physiological phenomena confers a control over neurological somatic phenomena. What happens in your body is because what happens in your mind to a certain extent. And therefore, if you control your mind, it helps to secure health and well-being. Homo sapiens, as we are known, should seek measures to attain control of somatic phenomena through exercises and yoga. This is where the relevance of yoga lies. Thank you very much for your patience.
Thank you, Dr. Ishwaran. It was a great talk. I think everybody got their stimulus in the nucleus accumbens. And a lot of dopamine is flowing around. Thank you so much. Now, the time is 12:04, and my own classmate Padmaja is to chair the next session at 12 o'clock. Still, we'll have one or two questions. Or no questions, everybody knew everything. Yeah, please.
Thank you very much for excellent talk, all of. I really enjoyed Dr. Ishwar's storytelling, and I was actually quite interested in the logotherapy, but I suppose we don't have time. We'll have a private conversation. But the question is to Dr. Rajesh Iyer, sir, please. That you mentioned yoga enhances neuroplasticity. Could you please elaborate on that? Thank you.
Well, so this is primarily based on the data we have on functional MRI and structural MRI. So if there was no neuroplasticity, so there are neuronal rest cells, and we believe that these cells are dormant and they don't actually participate in healing process. So this data by the structural functional MRI tests, and in subjects who have been practicing yoga, shows that there is an enhancement of the brain volume, the gray matter volume, as well as better networking. So this suggests that there is neuroplasticity, cells do multiply in the brain, otherwise this effect will not be visible. And that also translates to clinically visible changes in cognition and other functions, balance and other things and all. So this is the strongest evidence that neuroplasticity gets better with yoga and meditation.
Being a radiologist, I will just add on what is functional MRI. It's very simple. In fact, when I am talking, some areas in my brain is using a lot of oxygen, and some blood is going. And if you are actively listening, some other areas of your brain is using. And we have amazing machines. The MRI can find out where more oxygen is there, more blood is there. And you say that this area is functioning. And he says that with yoga, this area of functioning will increase. It's as simple as that.
My question, hello. Hello, Dr. Iyer. My question to Mr. Iyer.
Yeah, that's you.
Hello.
That's you.
Can you hear?
Oh, yeah.
My question to Mr. Iyer. Myself, Dr. S. Raghav.
Yes, sir.
My question is, any specific set of practice do you have for migraine? Something you can suggest?
Yeah, so
Like
the
what
pathogenesis of migraine is quite complex. The specific exercises which can help is various types of pranayam. So depending on each person's capabilities, they can do various types of pranayam. Yoga Nidra is a profound technique here. Very often migraines get triggered with lack of sleep. So if somebody can do that, you get a 20-25 minutes of intense meditative process, relax yourself. That makes a big difference, brings down your sympathetic activity, improves the circulation. So these are two techniques which we can strongly recommend based on pranayam and the physiology of yoga. But apart from that, it's not just these two things. The entire lifestyle has to be set right, and you have to live in tune with nature. And when you jump out of this, very often if you look at software engineers, they go to bed when people wake up. So if those kind of things can be set right, if you follow the circadian rhythm, your biological clock, then probably things can get better.
Can I add
sort of
something to that? Can I add, sir? Yeah, I'll tell you, my experience, we run a pain clinic for non-cancer pains in Sri Chitra Tirunal Institute for Medical Sciences. It has been on for the last 10 years. We get a lot of patients with migraine. That's all, One of the things which triggers migraine, which I have realized, apart from things that Dr. Rajesh was talking about, was unresolved conflicts in your mind. Unresolved conflict, mostly relationship issues and other things. A lot of things trigger migraine. Now, what does, I have done, I have advised my patients to practice yoga, but I can't say that in public because, being a scientific institute, we are still searching for yoga's scientific credibility. That's what the relevance of this meeting is. But then people who did that could find out something about themselves. As I said earlier about the Buddhist monk who did not get startled with a gun going off behind his back, we can shut out the negatives. Which means that you focus on the core things that you value. Once this realization comes, it becomes easy for you to secure freedom from migraine. This is based on experience, not based on any publication, scientific publication or literature.
In cases of migraine which you come across, is there any relationship to it coming down or increasing in relationship to the intake of alcohol? I mean.
True, sir. So there is something called wine-induced headaches. People who drink red wine, and very often people who don't take alcohol regularly, they do get headaches in the mornings. Okay. All right. So having said that, alcohol in moderate quantities can still be useful for various other types of euphoria and positive effects in the brain, which can be achieved better by yogic techniques by stimulating the endogenous morphioids. So alcohol doesn't per se add to headaches, but the withdrawal and the lack of that.
Especially migraine.
Yeah. So in migrainiers, when they consume alcohol, the intensity of migraine is definitely high. And in Bangalore, I have seen a lot of young women come in the morning with vomiting, severe headaches after a booze the previous night. Definitely it is there.
Please.
Yeah.
Hello, sir. My question is with respect to healing mental and physical trauma and supporting someone who has been through something like a terrorist act or has been a rape survivor. So the role of yoga in that.
Manjunath, sir? Maybe psychiatrist?
The physiology of healing, you can say.
I may not be the right person to comment on that because it's more of a psychological phenomenon, okay? Therefore, there are two aspects in the brain. One is the hardware, another is the software. All neurologists believe that hardware is the best. Software is what psychologists do. Therefore, I may not be the right person to comment about that. What was your question? Sorry.
Healing of physical and mental trauma.
I don't have evidence, especially when you are talking about PTSDs and things like that, or whatever be the trauma. I think somebody wants to comment.
Yeah, can I?
Please give.
I was going to say that psychological trauma is more of a memory issue. You get stuck in your memories and you get stuck in the past.
Okay, I can give a rational explanation. Therefore, we all think that yoga is, some part of the brain is involved. Which is the most evolved part of the brain is the frontal lobe, and therefore yoga is actually a product of the frontal lobe that helps us to rationalize. Therefore, there is limbic system, that is the old brain is still there, that is the emotional brain. Therefore, you have been given a rational brain to control the emotional brain. That is the physiology of it, neurophysiology of it. Yoga is purely a product of the frontal brain because it's a methodized effort. Therefore, you have to put effort in that. Limbic system doesn't put any effort; it reacts only. And therefore, yes, theoretically and to some extent, yoga has been used, especially in the US, because we have a lot of PTSDs over there, whatever I have seen. Rationally, yes, it makes sense that yoga should be useful, but how best to use and how to use it, probably it's not my domain. Therefore, I may not be able to say, but yes, if we start using our frontal lobe more and more, and be rational about everything. So, for example, one example of BD that Dr. Easwar was saying, we could rationalize, right? There is no BD right now. But ability to rationalize is something that we have to develop through yoga. That's what I can say.
Can I answer that?
You should.
I treat a lot of brain tumors, and many of them die, in spite of the best treatments, especially a tumor called as gliomas. So what happens is many of their spouses and children are all kind of left orphaned. And what I have realized is this logotherapy, about which I wanted to speak, but I didn't have the time to do that. Man is always searching for a meaning for his existence. And if we are able to give them a kind of rationale for their existence. Let's say, for example, I know a person who lost her husband when she was 25 with 2 children. I told her that she has to live for the sake of the children. So you shut out the negatives by focusing on what you have, your problem at hand. This is called as logotherapy. Viktor Frankl was the person who popularized it in the 1940s. Viktor's story was he was a Jew in Austria, in Vienna, when the Nazi forces moved in. Viktor was just married, and he was writing a book on logotherapy. He was writing this Man's Search for Meaning. He was getting very popular every day. Unfortunately, all that was cut short because the Nazis came in. They put him in a cattle truck, transported him to Auschwitz. His wife, he was recently married, his wife was taken to another, his parents were taken to another camp. There was no trace of what was happening to them. And Viktor decided to survive the camp by doing 2 things. As soon as he reached the camp, he was writing this book called Man's Search for a Meaning. The guards of the camp confiscated the book and burned it off. So Viktor lost everything, his family and his life's effort. Okay, now Viktor says, I'm going to live for 2 reasons. One, I believe that one day I will come out of the camp and go back to my wife and live with her. So every day he has an imaginary conversation with his wife. The Nazi guards call him mad, but then he continues to have the conversation with his wife. The second thing is, he by hearts narrates the lines of his book every day, so that as soon as one day when he comes out, he will be able to read. So that was the meaning that he conferred on himself. So when I see a victim of what they call fate, you have to give them an idea that life moves on for certain other reasons. This is the only way that they can be weaned away from the negative that has affected them. It's not easy.
So hope is the main thing. You live with a hope. And now we will hope that the next session will start immediately.
I have one more question. Question cum suggestion. Thank you for wonderful sessions. And I just want to know if, apart from the focus on brain and brain studies, has any studies happened on yoga therapy and relation to gene expression, and also gene expression and heredity and spirituality? So 2 different perspectives.
So this is the last question and the last answer.
Yesterday this was discussed by Dr. Srinivas. I am not sure whether you were there yesterday. Yes, there are some experiments published in good journals that there are genetic changes that are happening. We can call it as epigenetic changes rather than genetic changes, if you know the difference. Now, whether those epigenetic changes can lead to transmission to the next generation is a question we have not been able to answer yet. But it is possible, especially since I work in mitochondrial physiology. We all inherit our mitochondria from the mother. And all this, the mitochondria has its own genes. For it is possible that some of these epigenetic changes can be transmitted through the mother, because sperm doesn't give anything like that. Therefore, it is possible, but we don't have evidence. But yes, are there any changes at the genetic level with yoga? Definitely there are. There is evidence, good evidence actually. Whether that has a relation with spirituality, that we don't know, because there is always a bias. For those who are spiritually inclined, they might have been from the beginning that they have. Is the genes that are making them spiritually inclined, or is the other way? It is a chicken and egg question, we don't know. That's the biggest limitation of yoga research as well. Is that okay?
Thank you.
Thank you. Thank you. So
We are very sorry that we are not able to allow much more time for this question and answer session. We request our respected speakers to remain on stage for receiving mementos as a token of love and respect. I request our Honorable Chairman to come over to present the mementos. I request Dr. Manjunath to come forward to receive the memento. Dr. Rajesh B Iyer, please. Dr. Easwar H, please. I request Dr. Avinash Pandey, sir, Director, Inter-University Center for Yogic Sciences, Bengaluru, to come over and present the memento to our chairman of the session. Thanks to all the speakers of the previous session for such a wonderful, informative papers presented. And now I request Dr. Padmaja NP, Senior Consultant in Cardiology, KIMS Health Trivandrum, to come onto the stage to chair the next session, session 3.
Good day to all of you. I thank the organizers, especially Dr. Rekha, for giving me a chance to be associated with this program. I am yet to be initiated to the regular practice of yoga, but I understand the importance of yoga in my specialty, that is cardiology. Cardiovascular diseases are lifestyle diseases, and yoga could be a polypill for prevention and primary and secondary prevention of cardiovascular disease. I invite the first speaker of this program, Dr. Jayakumar, who is a multifaceted personality. He is currently the HOD of cardiothoracic surgery in Medical College, Kottayam. He is also the superintendent of Medical College, Kottayam, and he has many other interests. As I understand, he is very much interested in farming, and currently I know that he is in his role in yoga practice also. Dr. Jayakumar, please.
Thank you, Madam. Namam, sir, and a very good afternoon to all of you. It's a privilege to talk in this august audience, and I thank the organizers for giving me this opportunity. So we were hearing a lot about neurosciences, brain and the heart, brain and yoga. Now we will see what happens with the heart with yoga practice. So if you look at how to change, it's not going. Yeah. So if you look at the heart, there are so many things which are directly connected to the brain and directly connected to emotions. And if you look at the physiology part of it, definitely towards the adrenaline, noradrenaline, the pathology, the vagus tone, so many things. So I would like to just go through or just enumerate the diseases of the heart or the circulatory system, the risk factors which produces cardiovascular diseases, and what are the scientific evidences in managing the risk factors related to yoga, related to heart diseases and probably some of the knowledge gaps and possibilities. If you look at the circulatory system, it was the entire thing, like the area from where your blood is pumped to the entire body where the blood vessels are going, and the impure blood is coming back, and then it is getting oxygenated and going back. And the most important component, everything is important, but still, I'll say that the heart, which is the pump, it can have different types of diseases, as you know, diseases of the heart from birth, that is congenital heart disease. Then you can have valvular heart disease, something like say rheumatic or maybe infective, or so many things like or degenerative diseases of the heart. Then the one which I highlighted is the coronary artery disease, because there is one major problem which the humanity faces now. Then of course there are some other diseases like the diseases of the muscle or the tumors of the heart, like that. And if you look at the diseases of the cardiovascular system as such, it is not just the coronary artery disease, but it also involves stroke, which is already many of you are familiar. Then the aortic disease, that is again something which is on the increase. Like earlier when I was doing my MBBS or MS, I was not seeing such kind of aortic diseases. Right now you say that the Mahadhamini, or the major vessel, which dilates, ruptures, and patient comes to the casualty like that. So just like Dr. Easwar was saying, a fight with somebody, the BP shoots up, the aorta ruptures, aorta dissects, then it becomes a life-threatening emergency. Patients are coming like that. Then kidney diseases, again a huge problem, especially due to vascular issues. Then mesenteric ischemia, your intestine doesn't get adequate blood supply and lands up in problem. Then of course you must have seen so many people moving around with an amputated leg, or a leg which is revascularized and moving on with the pain. So these are the list of diseases which is related to the circulatory system mainly. And if you look at the magnitude of the problem, it is like, you know, in the first session, Dr. Vinita V. Nair was giving some very interesting or very positive things, like now the number of people who is practicing yoga is going up. But I am giving something very alarming, like your cardiovascular disease rates are going up. About 17.9 billion people die every year due to cardiovascular disease, and 85% of this is due to heart and stroke. And 3/4 of this happen in low and middle income. That means India is contributing a lot to this. But the most fortunate thing about this is it is mostly preventable if you address the risk factors properly, or if you adjust the lifestyle properly. And if you look at United Nations, because we don't have such proper statistics, 1 in 3 deaths, and the amount of money they have to spend in treating is huge, and the amount of money which is lost due to loss of manpower, because this is one thing which affects the young and energetic who are doing very well. So this is loss of man hours. And you see the difference in the progression of the cardiovascular disease in cause of death. Like from 2000 to 2019, it has increased from 6.8 to 8.9 millions. So you can see the huge increase in the problem that we are facing. And you must have seen, so like any other disease, there are so many risk factors which is going to add. But the beauty of this cardiovascular disease is something which is preventable. It is preventable, and we may say so many factors like high blood pressure, high cholesterol, diabetes, obesity, unhealthy diet, physical inactivity, smoking, all these are some of the risk factors leading on to heart disease and stroke. And these risk factors, there is adequate data to say that an ounce of prevention is worth a pound of cure. And this is where our science, the yoga, is going to help a lot. So, and it is not just prevention of cardiovascular disease, but at the same time it is also after treatment or along with treatment, or it helps in recovery, that is in the secondary prevention, and to lead a healthy life even after that. So when will you start this prevention? You may think that, okay, I am becoming 40s, I am in 50s and I am in 60s, so this is the time I should start. I should quit smoking, I should quit alcohol, then now I should not take up any strain. No. Actually, the prevention should start in fetal life. That is, a pregnant mother, her mental status, the way of thinking, the way she eat, okay, the family atmosphere, everything affects the child's health, and that reflects on to the later life in the form of hypertension, death due to coronary artery disease and all. So, the prevention starts, or a healthy life, I should say, rather than prevention, is a healthy life, starts in the fetal life. And it continues throughout. But there is adequate evidence that nobody is late. At any age, even at the age of 70 or 80, still there is a role for proper preventive measures, that is, adhering to the proper protocols of cardiovascular disease risk prevention. And if you look at this pyramid, so you have the cardiovascular risk management, and maybe I will say the most important thing which comes here is the lifestyle, which includes healthy diet, and if I go to the last part of it, is improve physical activity, and then just above that, better sleep health. You see, these three things, eating healthy, sattvic diet, doing proper physical activity regularly, and to get a good sleep. So that itself makes a major difference. Of course, along with that, as Dr. Iyer was saying, start meditation, you will get out of everything. Just like that, so your bad habits also goes off with that. And then metabolic things, or the metabolic parameters you look at for the heart disease, like blood pressure, or the blood sugar, or cholesterol, and say optimize your body mass index, or or to control the management of kidney disease if it has already happened. So that is also important in preventing the cardiovascular disease. And there is adequate evidence. This is one area where a lot of research has happened between yoga and heart disease. That is the metabolic aspects, like by measuring the BP in yoga practitioners, by measuring the metabolic parameters like cholesterol, sugar, insulin responsiveness, variable heart rate. This is one area where a lot of research has happened in seeing whether yoga is effective in controlling or in reducing heart problems. And definitely, if you look at the other socioeconomic and psychological and mental health, already a lot of discussion has happened, so I am not going to that. I am not a good I don't know much about that also, like to talk. Then what are the scientific evidences? Because the whole idea of our colloquium is to have a way by which we will be able to get scientific evidences for yoga practice, so that we convince our youth or our government or maybe the international community that yoga is something to be followed or to be adhered to for a healthy and long life, and to have a proper mental status so that you will be able to love your other human beings and go ahead. So what is the scientific evidence we have already? Like this is a review paper with a meta-analysis, and you see there are some good quality papers. 44 randomized controlled trials were analyzed in this. It came in the International Journal of Cardiology, and the conclusion is there is clinically important effects of yoga on most biological cardiovascular disease factors. Like already I said, this is about reducing the blood pressure, like Dr. Manjunath has already shown. Like it reduces the systolic blood pressure by around 5 or 6. It reduces the diastolic blood pressure by another 4 or 5. It reduces the heart rate, whether to at rest or response, and it reduces the cholesterol, triglycerides, HbA1c, which is the sugar. So many biochemical parameters is taken into consideration and shown that yoga is effective in reducing the risk factors related to that. And definitely meditation. Again, there is a study which is published In hypertension showing, and already American Heart Association has approved in, I think which year I just didn't get. So anyhow, it is a class 2B level B evidence of reducing the blood pressure. That means there may not be any randomized control trials, but it is, again, there is adequate evidence to say that the BP will come down by your meditation techniques. And there is an Indian study again which shows all these beneficial effects. Then another which came in 2013, that is the effect of yoga on cardiovascular risk factors. Again, you can see there are adequate number of good studies, 64 randomized trials, where 16,000 old people are eligible and assessed. And there is definite evidence or positive evidence to say it improves all these biochemical parameters and blood pressure. Then this is another which came in the international yoga. This is with the difference in this study is like it examined normal people, like what has happened with them. But you see, it was given only for a very brief period, 41 days, 75 minutes for 41 days. Even that has brought in major difference in form of improving the respiratory physiology, like forced vital capacity, or improving the heart rate and BP in a better way, and improving the biochemical parameters like lipids, sugar and all. So definitely there are other studies like morning Dr. Vinay was saying about the heart rate variability, which is again a reflection of the vagal tone, which improves with your yoga exercise, and say again blood pressure lowering effects. Then another thing which is examined to give objective evidence of yoga is the inflammatory markers. So once your sympathetic system is overactive, like Dr. Manjunath was saying in the morning, like your adrenaline, sympathetic system, the flight and fright response, you are energized, charged, but what happens is that triggers the inflammatory response. And that inflammatory response can be brought down by yoga. That is one thing, one postulation. And for that, you can measure different parameters in the blood for those who are doing yoga and for those who are not doing. And these are like, say, the cortisol level, C-reactive protein, and so many markers are there. And if you feel that those who are practitioners has decreased response with this inflammatory response, you can say that it is doing a good job in preventing or reducing the cardiovascular disease morbidity. And say stress levels, there are methods to measure the stress levels and how the stress levels, like the Buddhist monk. So with yoga, definitely you will be able to bring down, then improve endothelial function. This is another molecular level thing which we can do to objectively show, okay, yoga is doing good. And there are two pathways which already was discussed, like the yoga intervention, how it is going to help. Like one is the parasympathetic system. Already we had a lot of discussion about the vagal tone, and how the vagal tone, improved vagal tone, is going to improve your all the parameters related to the health, and how the decrease in the adrenaline tone or the decrease in the perceived stress or the sympathetic adrenal chain or your hypothalamic pituitary to say adrenaline axis. That axis stimulates the adrenaline in adrenaline stimulation and secretion and damages your overall health. So these are the two areas by which the yoga is going to, or yoga is going to help improving our health. And again, coming back to this, say definitely the risk management, that is one which is mostly discussed, and that is the one which is mostly experimented, and some research, some evidences are there to say that okay, yoga is good in managing or in reducing the cardiovascular disease, and then of course the life expectancy or the quality of life. But there are many gaps, of course. Whenever we talk about heart, the first thing comes to us is heart disease. But why don't we think about a heart which is healthy heart? It is not just the heart which is there, but the yogic heart also. So that means you should be able to have a comfortable, active, healthy, peaceful life. So this yoga, how we can objectively analyze and how to go about that. And there are a lot of ethnic differences. If you look at most of these studies, it comes from US or maybe from India, but we don't know the ethnic differences in the outcome. And the randomized control studies, there are a lot of issues in objectively measuring the outcomes. So we have to have more standardized protocols and more standardized randomization in getting disease. And like in yoga, one more thing, like Dr. Manjunath was saying, the training of yoga, how it happens. Like you can have, when you are doing the yoga postures itself, you will be concentrating, you will be meditating to some extent, and you will be doing some pranayama or the respiratory part of it. So a properly trained yoga person doing yoga versus a routine thing. So we cannot objectively measure between different studies how it has happened. So how to go about cancelling that effect on that. And definitely any molecule, because so many molecules are still there in the body which we don't know, because we know with meditation you get so much of comfort and pleasure, and the other side you get the same with morphine or alcohol. So something is there playing around which is still beyond our knowledge. So need to get scientific proof for many things, and a long way to go ahead. And definitely this colloquium, I think, should be stimulating us to think more and more about it, and to put more effort to bring in scientific evidences so that our younger generation, our people accept yoga, and we will be able to do a lot good to the world. Thank you so much. Thank you.
Thank you, Dr. Jayakumar, for the excellent talk. And I think this will, we should take more steps to initiate research into the cardiovascular effects of yoga. And so let me invite Dr. Kavita Chandran, Assistant Professor of Apex Trauma and Emergency Learning Center, Trivandrum, to talk on the effect of multilateral healthcare strategies on metabolic profile among pre-diabetes. Over to you.
Thank you, ma'am, for introducing me, and a warm good afternoon to each one of you who have gathered here. Unlike other great presentations, here I am here to tell something about the study which I have done as part of my higher education. Without taking much of your time, let me go into the title proper. The title is Multilateral Healthcare Strategies and Metabolic Profile Among Pre-Diabetics, which was a randomized controlled trial, and this study was funded by Government of Kerala through Kerala State Council for Science, Technology and Environment. So the background of this study, we all know that lifestyle disease has grown like an epidemic, and we see that about 422 million people worldwide have diabetes, and 5,778 million, it increases by around 2030, and it's going to increase to 700 million by 2045. And it accounts for 1.6 million deaths each year, that is type 2 diabetes mellitus, and this is the statistics given by International Diabetic Federation. India, which is known as the diabetic capital of the world, harbors more than 62 million diabetics, and Kerala, which is known as the diabetic capital of India, has the highest prevalence, that is 20%, double than that of the national average of 8%. The study conducted by Jayakumar et al. In 2019 revealed that the cumulative incidence was 21.9%, and the risk of pre-diabetes, this is of great importance, that is why it is highlighted in red. pre-diabetes in this study was much higher than the incidence of diabetes, that is 36.7%. We all know that type 2 diabetes is having multiple etiologies, and like the overweight or obesity, poor diet or unhealthy diet, smoking, physical inactivity, and psychological stress. And before a person could develop type 2 diabetes, there is a stage called as a pre-diabetes, which is characterized by impaired fasting glucose, IFG, or impaired glucose tolerance, and these people are at high risk of developing type 2 diabetes within few years, and the annual progression rate was 17% for IGT and 12% for IGF. So, interventions targeted at this pre-diabetic stage slows down the progression to type 2 diabetes, and many randomized controlled trials which was done in Finland, even India, China and US reported reduction of diabetes from 58% to 29% due to lifestyle modification. And we see that by 2040, India will face a projected rise of 123.5 million diabetes. Then why this study is needed? We have already seen that the morbidity as well as mortality of type 2 diabetes and potential complications are enormous and pose significant healthcare burden on both families and society. So socio-economic burden is also high, and in a resource-constrained state like Kerala or a country like India, the prevention pays dividends. Not only that, diabetes, when it affects the quality of life, and we have seen that in India, stress and endocrine stress response are associated with a higher risk of diabetes. 20% of people with newly diagnosed type 2 diabetes and IFG has depression, which urges the need of psychological assessment and intervention in their pre-diabetic stage itself. So many studies which is done in diabetes has shown that psychological stress through mind-body relaxation like yoga has resulted in better glycemic control and add to the prevention of type 2 diabetes. And we have also seen that many people in India are inactive, physically not active, with fewer than 10% engaging in recreational physical activity. So this study aims to bring out evidence of these multilateral healthcare intervention strategies on metabolic profile of pre-diabetes. The study had primary as well as secondary objective. The primary was to assess the effect of multilateral healthcare strategies on metabolic profile among pre-diabetes and development of type 2 diabetes. And secondary objective was to test the effect of multilateral healthcare strategies on anthropometric profile, psychological stress, quality of life, and knowledge in relation to prevention of type 2 diabetes. I will be concentrating only on primary objective because of lack of time, and probably if time permits, I will discuss on the secondary objectives too. So how we operated the variables. So first, what is this multilateral healthcare strategies? So we know that type 2 diabetes has multiple etiologies. So we have devised the intervention based on the review of literature and with the meetings and conferences with the experts in the field. We have fixed the multilateral healthcare strategies as a group-based training which was given to the pre-diabetic individual on yoga, exercise and preparation of healthy diet for 3 weeks, and the effect was the difference in the metabolic profile, anthropometric measures, stress, quality of life and knowledge with regard to prevention of type 2 diabetes between experimental and control group. Then who are these pre-diabetics in our study? Subject aged 35 to 55 years with a fasting blood glucose value of 100 to 125 mg per dl or 2-hour blood sugar value in OGTT, or that is oral glucose tolerance test, between 140 to 200 milligram per deciliter. Then the metabolic profile in this study refers to the biochemical parameters which reflect the metabolic function of pre-diabetics, which we included were FBS, oral glucose tolerance test, HbA1c, and the lipid profile, that is total cholesterol, triglyceride, HDL, LDL and VLDL, which was assessed by standard methods. Then anthropometric measures, as all of you know, these include body mass index as well as the waist hip ratio, which was assessed by standard methods. Then stress, I'm not going to going into the detail of this because this will be covered during discussion if time permits. So we also assess the stress, quality of life as well as knowledge of pre-diabetics in this study. Then coming on to the methodology. So the approach, the research approach was quantitative. Research design was a single blinded RCT or randomized controlled trial, and setting of the study was Indian Institute of Diabetes, Thiruvananthapuram, and study population comprised of pre-diabetic individual attending diabetic clinic of IID. We had a certain inclusion as well as exclusion criteria. We could not take up all the patient subjects for a scientific study. We should have some inclusion as well as exclusion. So the inclusions were male and female pre-diabetics who were in the age group of 35 to 55 years, who provided a written informed consent, who could read and understand regional language Malayalam, and the exclusion criteria were diagnosis of diabetes, terminal illness, cardiac arrhythmias, severe hypertension, chronic kidney diseases, chronic lung diseases, and history of cerebrovascular accident, and also some of the diseases as well as medication that caused hyperglycemia or raised blood sugar. Then pregnant and lactating women, and those who were on weight loss medication, those who had severe back pain, osteoarthritis or osteoporosis, which restrict them from doing the physical activity as well as yoga. And we also excluded those who were engaged in other trials within and outside the center and who were having psychological disabilities. The sample size for the study, we estimated the sample size for both primary as well as secondary objective, and the higher sample size of 130 was taken in this study, that is 130 subjects in the experimental and 130 subjects in the control group, comprising of 260 as a total sample size. Selection of subject, pre-diabetic subject after screening, and those who consented were selected for the study, and after getting the consent and after exclusion inclusion criteria, we had a sampling frame and we randomized using a block randomization technique, and blinding was done to add validity to our study and to avoid bias. This was a single blinded study. That means the person or the healthcare person who were assessing the outcome of our study were blinded to the allocation of the subjects. So this is a schematic representation of the study. So here after block randomization, we tested the subject, that is pre-test, that is using different tools. We assessed through tool 1, socio-personal and clinical data. Tool 2 was the metabolic profile assessment. Tool 3 was the general physical activity questionnaire. Tool 4 was a general stress index scale. And tool 5 was quality of life using WHO QOL BREF. And tool 6 was questionnaire to assess the knowledge. So after pre-test, this experimental group, we gave these interventions which included yoga training, exercise training, healthy diet preparation, and control group were given the standard care from the center that include healthcare counseling. So after that, they were post-tested. We followed this experimental group as well as control group for this 1 year. And the experimental group were strictly monitored for the adherence to the advices that we have given. We had WhatsApp group as well as the field visit by our field assistant as well as the research assistant to see whether they are compliant to what we have given the training. Then they were post-tested using the same tool at 6 months and 12 months, that is at the end of 1 year. And the data we have gathered, it was analyzed using descriptive as well as inferential statistics. The descriptive statistics was frequency distribution and percentage, and inferential statistics was, since it is a repeated measure, we used the test that is ANOVA, analysis of variance. Then ethical consideration, since this is a study on human beings, we have to consider the ethical aspect too. So the data was collected only after getting approval from Institutional Research Committee, Human Ethics Committee, and permission from CEO, Indian Institute of Diabetes, Trivandrum. So these are some of the clippings for our study. This is only the entrance of Indian Institute of Diabetes, where we conducted the screening process, all those things. And the multilateral healthcare strategies, which was for 3 weeks. The first week, on day 1, we gave an educational session on diabetes, its risk factors, treatment, and preventive measures, which lasted for 1 hour. From second day onwards, we had yoga training, that we had full-time yoga trainer Guruji, who were engaged sincerely in training them, and we had some asana. We made the intervention simple so that they could imbibe that into their usual routine practice. So only 3 asanas which is specifically targeted to reduce the psychological stress. So they include Kaya Kriya, Uttana, Shihosana as well as Shavasana, and pranayama were Anulom Vilom, Bhramari as well as Pranav Pranayam, which was selected based on the literature review and from the experts' view. Then in the second week, we had day 1 to 3 educational session on benefits of exercise. The training on treadmill was given, how to use, what all precautions they should take, all those things, and they underwent a 12-lead ECG prior to this treadmill exercise. Then brisk walking. So brisk walking is different techniques are there for brisk walking to become effective as an intervention. So from day 3 to 5, they were taught on this, and the third week, the last week, day 1, that is the educational session on healthy diet. So what is recommended daily allowance, what all are the food items which has high calories, which all are the healthy diet, and how do we prepare the diet based on the requirements of a sedentary, moderate as well as a heavy worker. So that were taught, and some meals, healthy meal preparation were also taught in the center. And then how to take height and weight and calculate the BMI as well as taking waist-hip ratio were taught to the outcome assessors as well as to the person engaged or the subjects in the study. They were also taught, and training was given on these measurements. And we prepared a booklet named Prameha Pradirodhini in Malayalam, or the regional language, which encompasses all the interventions which we have taught in a nutshell. And it was distributed to the experimental group. And all the tool and technique what we used for the study were validated and based on the standardized tool. Then coming on to the result. So distribution of subject based on socio-personal data. So we need to have a comparable group both in experimental and the comparability should be there in the experimental and control group. So the factors like all the socio-personal data or variables were assessed to know their comparability. So age, when you see, you can see the p-value is greater than 0.05. So the both group, the age were comparable. Then coming on to the gender, that was also comparable. And religion, majority were Hindus, and the results that is the between experimental and control, it was comparable. Education also, it was comparable between experimental and control group. Monthly income also comparable, majority were in the monthly income of 5,000 to 10,000, and marital status as well as type of family were also comparable in both the group. Then based on the risk factors, the distribution of subjects, that is we have assessed the array of risk factors for both the experimental and the control group, that is the common risk factors like smoking, the diet were compared, and you can see that they were comparable, both groups comparable with respect to the smoking habit as well as the dietary pattern. based on the physical activity, important thing that to observe in the study was 69.2 in the experimental and 70.9% of subjects were non-active. And they had a family history. Majority had the family history of type 2 diabetes too, and the results were comparable. And percentage of subject based on body mass index, here also we can see that both in experimental and control group, that is male and female, they were pre-obese. That is not only overweight, after that we come pre-obese and then obese. You can see that they were pre-obese. Then waist hip ratio also, it is very astonishing to note that in the experimental group as well as in the control group, 100 and 95% were above normal. And here also, that is in female also, 100 and 100. That means the abdominal obesity is high, as said in literature in this study also, and the results were comparable. So the comparison of mean and SD, or standard deviation of metabolic profile, experimental versus control group, you can see that before the study, these experimental as well as the control group were comparable with respect to the metabolic parameters, that is FBS, OGTT, HbA1c, and other parameters like total cholesterol, triglycerides, HDL, LDL, as well as VLDL, that is very low density lipoprotein. Then comparison of mean and SD of anthropometric measurements between experimental and control group. Here also we can see that the results were comparable between experimental and control group, since the p-value is higher than 0.05. Then comparing the waist hip ratio between experimental and control group, you can see that both groups were comparable since the p-value is greater than 0.05. Then coming on to the comparison of mean and SD of knowledge, stress and quality of life score between experimental and control group, we can see that both groups, that is experimental and control group, was comparable because p-value was higher than 0.05. Then coming on to the main part, that is the effect of multilateral healthcare strategies on metabolic profile among pre-diabetics. We assessed, as already told in the methodology, we assessed a baseline assessment 6 months, then 6 months and 12 years, and then we compared in different intervals, that is from baseline to 6 months, 6 months to 12 months, and finally baseline to 6 months. You can see that a considerable change was noted in the experimental group when compared to the control group, and that difference was statistically tested and it is highly significant. That is, there is comparable difference and our intervention was effective over time. Then oral glucose tolerance test also, we have the evidence that you can see from the statistical analysis. It is highly significant between the experimental and control group. HbA1c also, when you see the reduction, you can see at when you compare baseline versus the 12 months, you can see much reduction in the experimental group when compared to the control group, and that difference was statistically significant. Then changes in the total cholesterol also, you can see the difference. There was some change in the control group, but that is not that of experimental group, and the difference between these two also was statistically significant at the end of 12 months. Then triglycerides also, there is significant changes. Then high density lipoprotein, which is a good cholesterol, and you can see that it improved in the experimental group. There was slight improvement in the control group, but not much difference, and the difference was statistically significant. That means our intervention was effective. Then next, coming on to very low density lipoprotein, at the baseline versus 12 months, you can see there were changes in both experimental and control group, and we could not find any difference, statistical difference in this very low density lipoprotein, which is of not so significant when we consider the cardiometabolic risk factors. Then effect of multilateral health care strategies on development of type 2 DM, that is the main part of the study. When we see the epidemiological summary measures, we can see progression from pre-diabetes to diabetes. That was 0.76 in the experimental group, while in control group it was 6.92. Then cumulative incidence of diabetes at 12 months was 0.007, and in the control group it was 0.0698, that is the control event ratio. Relative risk was 0.11, absolute risk reduction was 0.06, and number need to treat, that is number need to treat or NNT is the number we need to treat or the cases we have to treat to prevent one incidence of diabetes. That was 16.25 in this study. So in conclusion, we can tell that healthcare, based on the scientific evidence, we can tell that healthcare interventions were effective in preventing the development of type 2 DM, could bring significant changes in FBS, OGTT, as well as HbA1c, the total cholesterol, triglyceride, HDL and LDL. And to add on, this was the first randomized controlled trial conducted in southern Kerala, which investigated multiple modalities along with yoga to delay the occurrence of type 2 DM among pre-diabetics. And we could sustain the intervention in the center. We have the full-fledged yoga and health club, which is now also functioning and which we initiated as part of this project, and successfully we are having many patients as well as the pre-diabetic individual utilizing the service of the yoga center. The strength of the study, the scientific study, was that it was a single-blinded randomized controlled trial which was appropriate for the assessment. We had only a low attrition rate or dropout, that is 0.38, and we could follow up the subjects with the help of
Dr. Kavita, can we conclude because
yeah. So
the time constraints?
Okay, so I had many slides and many more to tell, but due to time constraint I am concluding. And since we got a scientific evidence that we could effectively combine yoga with other lifestyle intervention, this study is going to benefit many, and many are utilizing the service which we initiated, or the intervention which we initiated, and we are very happy for getting the result like this, and we could save many people from the development of type 2 diabetes with simple and effective intervention. Thank you all.
Thank you, Dr. Kavita, for the nice presentation. I think, I'm sure you will get a lot of questions at the discussion time. Thank you. And now I invite Dr. S.S Raghav, Apollo Hospital, Chennai, for his talk on yoga and diabetes, a global perspective. He is a healthcare professional interested in the holistic approach to healthcare. He has MBA in hospital administration and fellowship in diabetes mellitus. Over to you, Dr. Raghav.
A very good afternoon to one and all present here. My slides will be simple, so you no need to worry, okay? My topic is yoga and diabetes, a global perspective. This is just a small introduction, and I also did a degree on yoga therapy. So I will discuss what are the benefits of doing yoga in diabetic management. In this session, we will be dealing about introduction, diabetes a growing concern, what are the challenges in conventional diabetic management, yoga, an ancient journey and modern understanding, a glimpse of various research studies and journals on diabetes, limitation of studies on yoga, and we will conclude. Okay, introduction. The purpose of this presentation is to shed light on integration of yoga into diabetic management, recognizing the interconnectedness of mind and body. So at the end of this session, we will know that will yoga help diabetes? This is statistics data, and in this slides, diabetes is a global concern. and it affects 3 to 4%. It affects globally. Globally, diabetes is a social and economic burden actually. And now we will see about Indian diabetic status. This is the latest study, and it has done in 2023, where this states that about 10% of the total population of Indians live with diabetes, and among those, the prevalence is high between the ages of 40 to 49 years of ages, and states like Tamil Nadu and Kerala see higher rates. The exact details and what are the reason for this is not known, yet to be studied. And among those urban and rural population, urban seems to have a high level of diabetes, and there is a generation gap also. Men are affected more than women. Now we will discuss about the challenges in conventional diabetic management. First one is cost and access. So it affects mainly the lower economic status people. So it is very difficult in getting medications and healthcare access, and healthy food option is also inaccessible to the lower economic status people. And there is a complex regimen is also one of the conventional difficulties. Regular monitoring of blood sugar, dietary restrictions, these are also causes these causes difficulties in conventional diabetic management. Then long-term effects are those patients who are taking regular insulin will be having hypoglycemia and injection site reactions. So this will impact their adherence, so they won't be having a regular diabetic management. Then lack of personalized support. These are nothing but elderly people needs someone to care so that they will be effectively taking diabetic medicines. Now we will deal about yoga. Yoga is a mind-body practice that combines physical posture, breathing exercise, meditation or relaxation. So the goal is to unite body, mind and spirit. Now we will unveil the science of yoga and its impact on glycemic control. So there are various factors that contribute to diabetes. One among them is stress. So now we'll see how stress contributing to diabetes and how yoga effectively reduces that. What is the mechanism behind this is stress increases the risk and severity of diabetes by stimulating hypothalamic pituitary adrenal axis, and it increases sympathetic axis, thereby the parasympathetic activity will be less, resulting in increased level of cortisol, epinephrine, norepinephrine growth hormones. These are the counter-regulatory hormones of insulin, which means when these hormones are high, there will be secretions of insulin will be less. So these are the counter-regulatory hormones of insulin. And also during stress, there will be an increased level of inflammatory cytokines, which causes insulin resistance. So when these two combines together, there will be an increased insulin resistance, hypertension and increased risk of cardiovascular events. So what yoga does is, yoga effectively reduces stress and thereby reducing counter-regulatory hormones, which increases the release of insulin. So there will be effective diabetic control. And apart from that, Surya Namaskaram plays a very important role in managing diabetes. So what is Surya Namaskaram? It is nothing but it involves a series of dynamic postures performed in a specific sequence. So when it is performed in a specific sequence and when it is performed actively, it increases cellular requirement for oxygen and glucose. And to meet these requirements, there will be increased insulin production, which is stimulated through brain signaling. So in diabetic management, Surya Namaskaram plays an important role. Then I will be telling about the asanas. So there are many asanas which helps diabetes, but these are the key asanas which helps diabetic management effectively. The three asanas are Ardha Matsyendrasana, Dhanusarasana and Bhujangasana. These are the asana poses. See, you can see that in all these three poses, there will be an effective abdominal contraction. Now we will see the science behind this. These asanas actively massages and pressurizes pancreas, thus it stimulates the secretions of insulin. And the additional benefit is also that these asanas squeezes the intestine, thereby preventing stagnations of colonic contents. So it is additional benefit. And apart from that, these asanas improves blood supply to the muscles, which may enhances insulin receptor expression in muscles, causing increased glucose uptake, helping in control of diabetes. There are also other studies which suggest that by doing these asanas, there may be regeneration of pancreatic cells, and pancreatic beta cell sensitivity is also increased by doing these asanas. So these three asanas plays a very important role in managing diabetes. And apart from stress, dietary management of diabetes is also improved with yoga. Let us see how. Actually, yoga is known to regulate eating patterns and helps in management of eating disorder. Actually, yoga is a mind-body connection. So what it will do is it will create a self-awareness so that the eating patterns will be, you will be aware of what you are doing. So the eating patterns will also change, which helps in prevent diabetes. And there are various other studies which states that diabetic related complications also reduced using yoga. Cardio-autonomic dysfunction is believed to cause a sudden death in patients with diabetes. By doing regular yoga, this cardio-autonomic dysfunction is reduced. And there are some other studies which shows that it stabilizes coagulation profile and it improves nerve conduction and cognitive function in patients with diabetes. And apart from this, these are general factors of yoga contributing to diabetic management. These are strengthening asanas. So what it will be doing is that your basal metabolic rate will be high, so that you will be burning more calories even at rest, and it improves your flexibility. Thereby you can do more workouts, which leads to higher calorie expenditure, and it improves sleep quality. Thereby the stress level will be reduced, so it will be effective in managing diabetes. So this is an outline how yoga practices can help in diabetic management. First one is behavioral changes. It improves physical activity and adherence to diet and medicines. It's a discipline. Then it reduces stress, thereby improving the quality of life and mood. And physiological changes with that, there are many studies which suggest that yoga reduces heart rate and it reduces blood pressure. And by practicing yoga regularly, there will be a effective body weight reduction, which prevents cholesterol accumulation. Therefore, it has an impact on lipid profile also. Then, as we have discussed, it has an impact of pancreatic beta cell regeneration. Then, as Madam has discussed previously, it has a role on immunomodulation by changes in gene expression and by decreasing the inflammatory response. Apart from that, yoga has an effect on sympathoadrenal and hypothalamic pituitary axis. Thereby, it reduces growth hormones cortisol level and it increases melatonin and endorphin. This endorphin, there is a saying that yoga is a state of euphoria. Because of this enzyme only, it is a state of, it gives an happiness, so it's a state of euphoria. Then other things are, it increases insulin secretion and reduces insulin resistance. As we discussed earlier, it helps in improvement of cardio-autonomic function and coagulation profile, nerve conduction and cognition. There are various other studies which shows that there is an effective reduction in HbA1c level by doing yoga, and this is a study done for a period of 12 weeks where yoga and walking both are taken into consideration, and the control group is without doing yoga and walking, and a participant of 1,820 people were involved, and after a period of 12 weeks, this study shows that there is an average decrease in HbA1c level of 0.5 to 0.7%, and the fasting blood sugar reduces about 30%, and the postprandial reduces about 20%. And there are other studies which shows that it also increases insulin sensitivity by better utilization of blood glucose level. No, by doing yoga, there are various other benefits on heart. We will discuss that also. There are various several studies which states that yoga has a role on cardiovascular health also. And as we have already mentioned, that it lowers heart rate, systolic and diastolic blood pressure. It strengthens immune system. And this survey is taken on patients who are diagnosed to have early stage of breast cancer. And by doing the study, they have found that it boosts immunoglobulin, and it helps in it boosts the immune system so that patient outcomes are good. And as we already discussed, it reduced inflammations. And there is also another studies which shows that yoga effectively reduces weight loss up to 1.7 kgs in individual practicing yoga for at least 12 weeks. And there is another study also which reduced BMI in overweight individuals who are practicing yoga regularly, but it depends on individuals' lifestyle and dietary habits. Now we will be talking about integrating yoga into diabetes care plan. See, personalized approach should be encouraged because patients who are diagnosed to have diabetes will be having various mobility restrictions. So same yoga cannot be given to all the individuals. So tailorized yoga can be given so that outcomes will be better, and poses can be modified according to their abilities to ensure safety and accessibility. And collaboration with healthcare providers. Healthcare providers should refer patients to a qualified yoga instructor so that they will know how to complement yoga for diabetic management. These are the patient concern. First, we should ensure safety, effectiveness, affordability, and accessibility. Now we will discuss about the limitation of studies on yoga. Clinical trial shows that there is a therapeutic effect of yoga on diabetes, often exhibits several shortcomings. There are several shortcomings. The shortcomings are inadequate control groups, small sample size, short duration of the study. So what we will do is we have to make a protocol and we have to do research so that we will be able to betterly interpret on studies in yoga. Now this is the closing statement. Now recent studies suggest that adopting yoga based lifestyle improves diabetes and its related risk. This modification appear to influence both neuroendocrine system and immunological mechanism holistically, contributing to diabetes control. It also activates parasympathetic nervous system and associated anti-stress mechanism, which improves metabolic and psychological profiles, insulin sensitivity, and glucose tolerance, as well as lipid metabolism in patients. So these are the references. This is a collaboration call to action. So we have to do various research in order to conclude that yoga is 100% effective in managing diabetes. So Western science join hands with the wisdom of Indian ancient medical system, so that by doing scientific researches we can unlock yoga's full potential for healthier future. Actually, this is Daya Yoga. This is a yoga center which owned by me. And what we have done is we have taken a patient between the ages of 40 to 60 and who requires only anti-diabetic medication, 1 or 2 medication, and this study shows that these patients are not on insulin, they require only OHS. And after doing yoga for a period of 1 month with 45 minutes per day for a period of 6 days in a week, this is the analysis we have got. What we have used is we have used dietary modification, we have used oral hypoglycemic agents, and we have used yoga. You can see there is an effective decreases in blood sugar level, both fasting and postprandial. So this does not conclude that yoga is 100% beneficial. What I am trying to say is it is beneficial. Extensive research and studies has to be conducted so that we can say that it is 100% effective. So this is just a Daya Yoga where a physician is there and we will have a yoga therapist. We will tailor yoga and accordingly we will proceed. Thank you. This is
Thank you, Dr. Raghav, for the nice talk and stopping ahead of time also. And I know all the speakers I thank all the speakers for the excellent talk, and all were highlighting the usefulness of yoga in managing all lifestyle diseases. Thank you. And due to constraint of time, we have to have the question and answer session along with the lunch time.
So anybody having any doubts on the subjects just now we had, you can have the doubts cleared during the lunch time, and I request all to be back by 2 p.m.